Today I'm going to talk about hip rolls, which is a great stability exercise. And with this particular exercise, what I'm looking for you to do is to maintain your pelvic position, not let it roll left to right. So I'll hop into the correct position. So my legs are bent around 90 degrees, feet are hip width apart. I'll find my neutral pelvis. You all know how to do that with the butterfly position. And I'll feel that natural curve under my lower back, filled by my sponge. And what I want to do here is imagine there's a plate on my tummy with a marble right above my belly button. And what I'm going to do is, keeping my left knee nice and still, I'm going to just drop the right knee out to the side and feel it drop down towards the floor as far as it'll go without the pelvis rolling. Then, as I breathe in, I'll bring it back. Then I'll keep the right knee still. And again, keeping my hips nice and still, I'll drop the left knee out to the side. I'm rolling onto the outside of my foot. And I'll breathe in as I come back. So I want to tune into my sense of touch. I've got my sense of touch through my hands, but I also have the sense of touch through my feet, the back of my hips, all over my body. And so as I drop the right knee to the side, I'll feel myself rolling onto the outside of my right foot, and I'll also feel that I'm not rolling or moving through the base of my left foot. I'm also not feeling myself rolling across my sacrum onto my left ilium or onto my right ilium, which of course is part of the pelvis. So I'm just doing this as nice and slow and controlled as I can. So this exercise is called hip rolls. And I've started off by actually doing knee drops. So this is knee drops we're currently doing. But then to do my hip rolls, normally I'd slide on the carpet or I can float above the mat, lengthen the leg out in external rotation before I rotate in and then slide or float back in. Return that foot to the floor. I like you to alternate with this exercise. I'll lift the foot off the floor, I'll drop down to the side, lengthen out. So normally I would do this sliding on the carpet wearing socks, but with my feet on the mat, I'll tend to float above the floor instead. So I'm looking at keeping my marble balanced on my plate. I can use my hands again to check that nothing is changing. I'll change my body alignment in a moment for you so you can see it from a different angle. And I can actually also do this in the opposite direction as well. So, which is actually a little bit harder. So my hips are on the mat and I'm going to drop my right knee out to the side, keeping my pelvis perfectly still. I'm going to slide out this time, lengthening through the heel before I rotate in and slide in. Now I made a groove in the sand or in the carpet with my right heel as I slid out and back. I'm going to make another groove with my left heel. I'll slide out along the groove, I'll rotate in and I'll slide back on exactly the same groove. So there's two grooves in the sand or in the carpet that I'm making, and they are hip width apart. They're parallel. Just take your time. Be aware if there is any rolling left to right. First thing you want to do is obviously try to stop it, but you want to be aware if you do roll the hips left to right. And then you want to minimize it as much as you are able to. So you minimize it and you try to come back to neutral as soon as you can. So try to stop it from happening, but be aware if it does happen. Come back to neutral as soon as you're able and then go to the other side. By alternating from one side to the other, it'll make you a lot more aware if the pelvis is rotating. Whereas if you did one on one side multiple times and then switched, it's harder to be aware of that.